Good afternoon, everyone. Welcome to Focal Points. Today, we're going to be discussing a breaking, brand new study of 15,000 nursing homes and the death risk seen in the vaccinated elderly population. And it's very, very shocking and very damning. And joining me is Dr. Nathaniel Mead. He is a McCullough Foundation scholar and he played an instrumental part in this study. So, Dr. Mead, why don't you start to tell us? So, why did you do this study, and what did you find?
Well, hi Nick, good to see you. The interest in doing this study was really that for the past 6 years, as we all know, the elderly have been the ones that were thought to be protected by the vaccines. And so we're talking about the COVID mRNA, synthetic mRNA shots that we can simply call the COVID shots. So we were interested in seeing whether or not the elderly in the long-term care facilities or nursing homes in the United States were possibly protected or adversely affected by the shots. So that was the impetus. I think there was a lot of interest during the early part of the pandemic in terms of the elderly being at high risk of dying from COVID. And so it made sense that the COVID shots should help protect against that. And that was the intention, I think, initially. That was the target group, the group that would be most vulnerable and, hopefully protected. So that was the interest in doing this study. Yeah.
Okay, so you did the study, and now looking at this central figure. So let's see. Let's start with the top left panel, data collected. So what kind of data was collected, and where was it collected from?
Yeah. So it was weekly. This is a fairly large study. So you mentioned 15,000. There were 15,022 U.S. nursing homes. We were looking at weekly data from each nursing home. So this is Medicare CDC data. And the fact that it's CDC data is, it should be good data. And it is considered, pretty reliable. Unfortunately, the CDC recently took it off of public access. So we that we managed to get it in time before it was removed from public access, and we now have it on a separate server on the Zenodo server as an extract of the overall database, overall data set. So this was data that was collected from May 2022, really June 2022 through June 2023. So that was a critical year in terms of vaccinations. And by this time, a lot of the elderly people were well into their boosters and were getting their third and fourth shots, which would be the first and second booster. So we were examining all-cause mortality, which is death from any cause, alongside the SARS-CoV-2 exposure, which by 2022 is Omicron, mostly Omicron, and that we were looking at positive test results. And then that was being stratified according to the long-term residents' vaccination status. So it was whether they were unvaccinated, partially vaccinated, or fully vaccinated. But as you know, there's a little bit of problem with that data, because when you break it up that way and it's using the CDC definition, unfortunately, we get into that problem of, fully vaccinated means 14 days after the second shot. And so if you're looking at deaths relative to that, for the past, 5-6 years, as we know, people were being told that the unvaccinated were dying at a high level, but in fact, many of those deaths were very likely adverse effects of the shots that were counted as unvaccinated, but they were deaths that occurred prior to 14 days after the second shot. So it was a kind of misclassification. And that actually, in the context of this study, that would mean that we're probably looking at underestimates of death attributed to vaccination status. We used what are called mixed Poisson regression adjusted for confounders, and that allowed us to overcome the problem of reverse causation. So we're looking at different confounders, time invariant, time varying confounders, and this is another way of making the study more rigorous. But anyway, what we found, the really key finding was that relative to the unvaccinated, which was a relatively small proportion, it was only 10% of the overall population, the elevation in mortality persisted longer among the vaccinated. It lasted approximately 3 weeks for the partially vaccinated and 6 total extra weeks for the fully vaccinated. So the unvaccinated, everyone showed elevated mortality in the first week. And then you saw a few extra weeks of the partially unvaccinated for the partially vaccinated, and then 5 extra after that first week for the fully vaccinated. And so what this is really important to say that we can't really say that the total death amount was larger for the vaccinated versus the unvaccinated. But what we can say is that there was a longer period of death after that initial starting point. So that's really important to emphasize, because the study was really not designed to measure the exact number of deaths, how many deaths there were in relation to vaccination or infection. The infection spikes led to more deaths across the board. That's true. And that's what you would expect with elderly people, especially the more frail elderly in nursing homes, that they would tend to die from infection, just like with the flu. And so, but then the COVID shots didn't appear to shorten the overall mortality burden from the infection waves. And that was something that was claimed, is that the vaccines would reduce the overall mortality from the infection waves, and it should have shortened the period instead of lengthened it.
Right. Right. Yeah, that was their main talking point. Their main talking point was, oh, well, the shots don't prevent transmission. They don't prevent infection, but oh, they prevent hospitalization and death. But, according to this data, it looks like the complete opposite. And
Right.
so, and let's give a quick, rundown one more time of the main findings there, just
Yeah,
for everyone to easily understand. So it looks like the first event where it says before, that's when they got infected, right?
that's
Like
right.
that's the infection date.
That's
Okay, so unvaccinated. We'll
right.
start there. They had a week
That's right.
of excess mortality risk.
That's
Then
right.
we get the partially vaccinated. They have 3 weeks of excess mortality risk after infection. And then
That's
the fully vaccinated, look at 6 weeks. So the more vaccines they got, the longer their risk of death was after becoming infected. So
that's right.
what's the mechanism you think behind this?
Well, it's interesting, Nick. There's kind of in a way, there's a kind of double think going on here. I happen to be rereading 1984 right now, Orwell's 1984, and there is a kind of double speak going on with, or double think, double speak going on with the interpretation from a pro-vaccine point of view. From the pro-vaccine point of view, they would say that the unvaccinated could have died from more acute events in the first week, and that the vaccinated had some kind of alteration of the pathogenesis of the natural history of the infection and so that it extended the period. So that would be a pro-vaccination interpretation, that there was some change in the way that the disease unfolded for the vaccinated versus the unvaccinated that would cause this extended period of risk. But it's also hard to justify that point of view when you think of, first of all, the Cleveland Clinic study showing that there was more infection related to the vaccination. So we may be seeing more infection related to the vaccination that could be translating into more morbidity and mortality. We shouldn't see we should see a reduction in severe disease and mortality with more vaccination if the theory is correct that that's what vaccines do. And that's clearly what we're not seeing. It could also be that we're seeing an interaction between the vaccine and the infection that is compatible with what we call the hybrid harms hypothesis, which we addressed in our previous paper that you and I co-authored along with others. That looked at the possibility of additives or synergistic effects with the vaccine being superimposed on a population. The infection being superimposed on a population that's heavily vaccinated. That was our theory. Right, thank you. That when you see a population, like many of the populations around the world, were heavily vaccinated. That's true of the nursing home population, heavily vaccinated, 80 to 90% in most countries. And so then you get the infection that's occurring, which shouldn't occur, right? The vaccine's supposed to prevent it, but it actually seems to be promoting it based on the Cleveland Clinic studies and other data. And then you have an interaction between the spike protein caused from the vaccine, generated by the vaccine, producing the spikopathy issues that are related to inflammation and immune dysfunction. And you have that resulting from the infection as well. But we think that the vaccination, because it results in much more prolonged spike production and much more intense spike production, along with other things that are in the vaccine, that you have more inflammation, and that's the nature of the hybrid harm. So this study could be some evidence of that, but we would need to do a much better, perspective kind of study to really determine if that's happening. And of course, that's not going to be possible in our current context.
Right, right, definitely. Well, that makes sense. So the mRNA injections are turbocharging basically the risks of the infection, right? So it's not preventing anything; it's just making everything much worse.
It certainly could be. It certainly could be, and I think it's it's interesting. There is the Excess Mortality Project that Finance Technologies put out, Ed Dowd's project. I know you're familiar with that. They showed excess mortality in 2022 for the younger age groups, but it did not translate to the older age groups until 2023. Very interesting. When they did age stratified analysis, the older age groups showed the excess mortality starting in 2023 in terms of what would be considered a significant increase in excess mortality. So all age groups as of 2023 were showing the excess mortality. And that could suggest that the vaccines are having persistent adverse effects that are affecting diseases with a longer latency, such as neurological diseases and cancers and things like that you would expect with a longer latency. And so it's an interesting issue, and I think this study is a really important contribution. Dr. Chris Dennerhink is the lead author. He did most of the work on the study. Russ Wolfinger is a statistician originally from the Research Triangle. in North Carolina. And the two of them did the hardcore analytic work in this paper. I assisted with interpretation and with the writing and the overall research synthesis. So it's a very important paper, and I think it's important. It's critical that we consider this at least a signal that needs to be looked at. For the elderly population, they appeared to be not protected by these, and it's also true that the nursing homes are not the healthiest places to be in the United States. They have very bad nutrition, unfortunately, for most of these homes. A lot of the elderly people are not encouraged to exercise regularly, so it's not a healthy environment. And then you throw in something that really disrupts the immune system, like the synthetic modified mRNA vaccines, and it becomes a much more serious issue.
Definitely. So
Yeah.
this looks like the main tables. What's an easy way to interpret this table?
Well, I personally think that the best for the layperson, the best thing is to jump to the discussion. I think the opening
Yeah.
paragraph from the discussion gives a really nice summary of what we found. And I don't have the paper in front of me, so you're welcome to read it. But I think that's the best way to interpret that table. And then also in the discussion itself, we offer an interpretation of that table.
Definitely. Well, for all the audience watching, this is where you will find the study. You will find the study on the European Society of Medicine, their journal, Medical Research Archives. Type it in, click on the current issue, and you will find this paper to read, download, and share. And this is very important. This is what the CDC should have done, years ago, but they haven't. And so Dr. Mead and the team he was working with did the work that the public health agencies should have done. So, Dr. Mead, what else do you want to tell us? Anything else about this paper or anything else before we wrap up?
Yeah, I mean, I think Dr. McCullough actually brought this up in a recent discussion, that he's very concerned that we can't directly determine how many nursing home patients died after vaccination because the numbers are not good enough to really determine that. So his concern is that the world may never know if their deaths were concealed by the COVID diagnosis. So that this is again related to the hybrid harms paper, and it's really important, I think, that people refer to that paper as well, so they can understand why we think this is such a serious issue. It's really a problem of scientific discussion. We should be able to have an open scientific discussion about this, and I'm sure we won't see the mainstream media reporting on this, and that's really sad. But it's because they've been saying for years that the elderly were protected by these shots. And so they're not willing to have an open discussion to really look at the safety for the elderly. And that's really sad. We know that the elderly always die in higher numbers because as you get older, you die more. So their deaths have been hidden in a lot of the statistics up until now. And I think this is an important study because it attempts to sort out some of the sources of bias and confounding that allow research scientists to hide the deaths among the elderly. So I think we're moving in a direction, hopefully, of more truth telling. I think it's very, very likely that many deaths were indeed concealed from the public, over the past 5 or 6 years. It's very unfortunate. But I'm very proud of my colleagues, my co-authors on this paper, and I encourage everyone to take a look.
Yes, we did a fantastic job. This is a critical study for public health, and I very much applaud you and your team for doing that work. So,
Thank you.
Dr. Mead, is there anywhere where people can find you or follow you that you might want to share?
I'm on X, social media, Nathan Mead. Let's see, what is it? Nathan Mead. You should be able to find me that way on X. And I am, of course, really devoted to working with the McCullough Foundation on more papers, and will continue to do so. Yeah.
Definitely. Yeah, you have the best papers with, 300, 400 references, and you put it together the best.
Well,
Nobody else can do it as good as you. So we're very happy to have you on the McCullough Foundation team.
thank you, Nick. Well, it's an honor. Thank you. Thank you very much.
All right, thanks for joining. Thanks everyone for listening.